thank you for doing this.
Thank you for having me. This means a lot because there's just so much misinformation right now at the federal government level. And I'm curious about, from your standpoint, is we have people like RFK Jr. and President Trump saying a lot of misinformation. And in Illinois, what are you going to try to do to try to address this in real time and make sure that we have concrete guardrails to protect science and evidence-based medicine?
Well, let's start with, we've got to make sure that we're persistently and consistently informing the public. Because what's happening in Washington is they're misinforming, or maybe disinforming is another way to say it. And so we've just got to make sure, and we've got some of the world's great experts right here in Chicago and in Illinois, but making sure they're out front, that people are listening to them, to their expertise. And again, you know, as I've often said to people, you can choose whatever you like for your health, what you think is best, but listen to the best experts. You can decide not to listen to them if you want, but at least hear the evidence, hear what I would say is the truth of what we know, and they're looking at the data and making those recommendations based on facts. And then you can make your own decisions. But the other part of this is, don't go on social media, read something from someone who says they're a doctor or someone who claims to have medical expertise. You really don't know. And listen to that when you can call a doctor or even call the Department of Public Health if you don't have your own doctor or one that's not readily available. So promoting real information and facts so people can have it in front of them is one thing. And then I'll just say the other thing, which is we have a very, very competent Department of Public Health for the state as well as county departments of public health. And those county departments of public health are very important for informing people they know in their local communities.
It's one of the worries that my patients have right now because of what RFK Jr. has done with the advisory committee on immunization practices, gutting it entirely, and then putting in people who are not practicing evidence-based science and making vaccine recommendations that go against what we've been doing for a while. So they're wondering what's going to happen to our vaccine access? What is Illinois going to do to safeguard that as well?
Good question, and this is what we're, behind the scenes, what we've been doing since we knew that they were going to basically pull back on vaccine recommendations, indeed recommend against in some cases. Everything we want to do is based upon the best information that's available. We have our own vaccine advisory group in the state, and as I mentioned before, we have some of the greatest medical centers, hospitals, and doctors in the world. So we can put that together. Maybe in some other state, I don't want to name them, but a small state where they may not have that kind of expertise. They can't do it, but we can. So what we did was we first got them together and made sure that we were listening to what they said about vaccines. And essentially, they've endorsed what the vast majority, in fact, more than 90% of all doctors have endorsed, right? So we talked about that a little bit in our event today. And as a result of that endorsement, it encourages the vaccine makers and the doctors to bring vaccines into the state of Illinois. So we've actually purchased some for the state, that the state has available, the counties, and importantly, doctors have it available to them because people understand the recommendations in the state of Illinois are to get vaccinated. So that again, what we want to make sure doesn't happen is the supply doesn't even get manufactured because of the recommendations at the federal level. Indeed, we want that supply to continue. So encouraging that and then purchasing some of it ourselves for the state to have as part of a stockpile. Hugely important.
That is so reassuring to hear because a lot of my patients are worried about vaccine access. What is the one medical myth, if you had to choose right now, you were to put to bed? 10, 15 seconds. What would you say that one thing is right now?
Well, I've talked about this before, and I think, I guess, and again, I think there are so many myths that they've promoted at the Department of Health and Human Services in Washington, or RFK Jr., and of course the president. The first thing I would say about a myth that needs to be burst is vaccines do not cause autism. Just don't. Second, hugely important, but I put that first because I think that's just a cruel myth that needs to be busted immediately. The second, and maybe larger point is vaccines are tested, retested. Vaccines have been proven over many years to work. The ones you've heard of, if you think that there were people who thought, well, the COVID vaccine got, developed in a short period of time, maybe it isn't really effective. Or they thought maybe it's bad for you because it hasn't been fully tested. Maybe that was something that people thought. Now it's been around for years, and it's been tested and retested, and there's enough skepticism so people really have examined them. They work. But let's put that aside, and let's just talk about the MMR vaccine, or let's talk about the many other several vaccines that are important for babies and young people to get. One of the reasons that you don't see many outbreaks of measles is because most people have been vaccinated for measles. When people stopped getting vaccinated for measles because they started getting skeptical, and when I say stopped, I mean it's less than 10% that stopped, but that has an effect. When people don't get vaccinated, guess what? You get outbreaks. And that should be worrisome to everybody. Measles can be deadly, and so can polio, and we could go on and on about the number of vaccines. We need our children to get vaccinated so that they are not, because they are often the most immunocompromised, or at least early on in their lives, they're unable to fend off diseases. And it's important for them to be able to do that. And that's what, when you have a baby in a hospital and you get offered the opportunity to have your baby vaccinated, very important for people to have the facts when they're making their decisions. Vast majority of people do make the right decision, which is good, but I once again would say, ask your doctor.
Exactly. Which, when we talk about vaccines and autism, it's become this issue related to stigmatizing people with autism. And it's become this quote-unquote epidemic that the administration keeps talking about, which is really despicable. What I want to know from you and from the state of Illinois is how are we able to best support people who have autism spectrum disorder, given all of this type of rhetoric that's going on right now?
Well, I think there are two things. First, I'm making sure when people understand the facts and that indeed it's not vaccines that have caused autism, for example, it takes away part of the stigma that's being put on them. So that's very important. I think people, people understanding better what is autism, right? It's about brain function. And that it's not caused by vaccines. And that starts, to at least debunk this idea that there's something, that was preventable. And think about the families of autistic people who have cared for their children or adults, right, and have helped them through and to become often productive members of society, some even highly successful. But think about what it does to the families, to the moms, when you make claims like acetaminophen causes autism, and they may have taken Tylenol at the direction of their doctor, and then their child had autism. There's not a direct causation. That's absolutely false. Indeed, all of the studies have proven that. But I think people are looking for someone to blame for something that feels inexplicable because it's complex. If we could do away with that, I think that is perhaps the biggest way that we can support people with autism. Meanwhile, we have programs that support from the state of Illinois for families and for people with autism. And I had to say, before I became governor, the previous governor cut many of those programs. When I came in, we put those back into place, and he cut it during World Autism Day. Actually, it was the day that he cut those programs. So, we have programs to support the parents, and again, it's to make sure that they have everything available to them to help their autistic child or young adult or adult become productive.
Thank you so much for this conversation.
Thank you. So great to meet you. Really an honor. Thank you.
Thank you.